Come in. I wanted to call you.
Yeah, I'm going to start today, then they will the email address.
Please close your mic.
And then it looks like it's called Zoom.
Michelle?
Yeah.
Microphone.
Okay. All right. Okay. Bye.
Colleagues, please keep your microphones closed. Thank you. Good morning, everyone. Welcome again to the National Institute for Occupational Health, the NIOH's webinar. And this webinar series, we are pleased to say, is done in collaboration with the National Economic Development Labour Council, Nedlac. And it is a webinar series that's going to stretch over 27 webinars, which would include other supporting materials like information sheets and fact sheets and posters, 27 of them, and some short videos. So it's my pleasure to welcome you to this session. It's our second session in the series after the launch last year. And this is entitled The Minimum Occupational Health and Safety Services for the Workplace. Without further details, or rather further delay, I just want to say a few very quick words to our attendees. Please, your microphones are not activated. Your hand raising function is not activated either, so please lower your hands. Please type all of your questions in the question and answer box. You will see the two speech bubbles at the bottom of your Zoom box, your Zoom screen, your main Zoom screen, and that's where you type your questions, where our speakers and non-speaking panelists will answer your questions. And also, you do not have share screening facilities, so please just stick to those house rules. And without further delay, I'm going to introduce the panelist who's going to address this broader theme of minimum occupational health and safety services for the workplace. And we will be discussing what workplace stakeholders need to know on minimum occupational health and safety services. So our first speaker is Dr. Odette Volmink. And she will speak to the issues related mainly to professional categories of people involved in our workplace health and safety. We also have Professor Zinkulu Zungu. He will speak to the role of regulators, the enforcers and so on at a regulatory and legal level. And then we will have Ms. Michelle Morgan. She'll speak to the stakeholders category of workers and employees. And then finally, we have our guest speaker and panelist, Mr. Puleng Nele from the National Union of Metal Workers South Africa, NUMSA, and he'll speak to, he'll speak to the employees and workers section, and our colleague Michelle Morgan will speak to the employer section. Correction on that. And without further ado, I'm going to ask our panelists to join us, please, and to open up their video links, or if they're okay with their photographs, that's also fine. And I'm going to ask the first question to Dr. Odette Volmink. And before I ask the question, so to our attendees and our participants, our audience, this is a panel discussion format. We will not be having any PowerPoint presentations, so I'll be asking questions of our panelists. So the first question to Dr. Odette, it's a bit long, Dr. Volmink. When you start with providing minimum occupational health services, if you do not have an occupational health service in the workplace, over to you, Odette. If you could unmute, Odette.
Thanks, Ashraf. I think the best place to start with regards to guidance is the Occupational Health and Safety Act. This gives quite good guidance in terms of what services are necessary. And it puts the onus on the employer to provide these services. Under the Occupational Health and Safety Act, there are certain regulations that gives more specific requirements to the employer where workers are exposed to certain hazards in the workplace, like noise-induced hearing loss regulations, specifies what needs to be done when workers are exposed to noise above 85 decibels. And then there's also certain regulations that applies to specific industries, like the construction regulations that gives guidance on the specific requirements for different types of work, like excavation or demolition or such, etc. So it's important to also remember that occupational health services are preventative services. And these services are responsible for advising both the employer and the employee on what the requirements are to maintain a safe and healthy working environment. And this requires a multidisciplinary approach that doesn't need to only address the health issues, but also must take into account the safety issues, the ergonomic issues, the psychosocial issues, and even the organizational aspects of work and the working environment. So if there's nothing in place in the workplace, it's important for companies to start implementing occupational health services. And in order to do this, a lot of planning needs to go into these services, because these services need to be tailor-made to the specific requirements of the company, even sometimes at a departmental level. It needs to take into account the type of work, processes, the type of production, what are the raw materials that are used, are the chemicals used, what are the safety data sheets of those chemicals, are there any known occupational health and safety issues in the workplace, like what accidents have happened in the past, what have been the cause of these accidents, maybe looking at the sickness absence of the employees, but also taking into account the characteristics of the workforce, what gender predominates, maybe there may be a common occupational issue, and all these things must be used in planning the services out effectively and specifically for that company. Thanks, Ashraf.
Thanks for that. So just a follow-up question, and I'm going to combine. Supposed to be an occupational service, and the second part is, while the entire Health and Safety Act is important and needs to be complied with, what are some of the quicker and priority aspects that employers and employees can implement?
Okay, thanks, Ashraf. It's always important to sort of start this out by doing a health risk assessment. And it's almost like a situational analysis and oftentimes done as a walkthrough. It can include health and safety representatives, employer representatives, the manager or a representative of the employer as well as employee reps. And the main purpose of the health risk assessment is firstly to identify the occupational hazards in the workplace and which workers are affected or could be exposed to these hazards. Hazards can be physical hazards like noise and vibration and temperature and lighting, or biological hazards like COVID was to healthcare workers. It can be ergonomic or psychosocial hazards. And it's important that you not only identify the hazards in the workplace, but also the level of risk. Is it mild risk to the workers, moderate or even high level of risk? And also what controls are in place to mitigate these hazards? And are there any additional controls that possibly could be added to ensure that these hazards are minimized as much as possible? It's also important in an occupational health service to provide information and training to workers, because it is a worker's right to know about the hazards and the risks that they are exposed to in their working environments. The employer also needs to provide for health assessments, and these health assessments often look at early health effects that could be related to the specific exposures in the workplace. And it also looks at the suitability of the worker to carry out certain job functions, because there could be workers who are particularly vulnerable to certain exposures in the workplace. The service also needs to address safety needs and look at the prevention of accidents in the workplace by identifying the risks of accidents and also putting in controls in place by having first aid and also being prepared for emergencies that could arise in the workplace. Thanks, Sasha.
Thanks for that. Let me move over to Michelle Morgan. Michelle, what is the low-hanging fruit in terms of the Act, the Occupational Health and Safety Act, that employers need to implement? Michelle?
Hi, Ashraf. Thank you so much. So basically, every workplace needs to have a copy of the OHS Act. It needs to be available and accessible to all staff. The workplace must also have a health and safety policy. It's like a SHE policy. And the policy statement needs to be prominently displayed, preferably in all workplaces. Legal appointments are very important in terms of the Act, and these include Section 16.2 appointments, first aider appointments, fire wardens, health and safety reps, etc. Then in terms of health and safety reps, they need to be appointed for a specific period. This must be in line with your policy in the organization. And health and safety reps must be trained. They must be given time off from their regular duties to fulfill their health and safety rep duties. These duties include things like walkthroughs and inspections of the workplace, being a member of the Health and Safety Committee. They also need to attend meetings. They need to be the eyes and ears of the employer on the ground, in that they would be the direct contact with the employees and listen to their concerns, etc. They also need to be involved in risk assessments and the incident reporting and investigation process. And as per the Act, the number of health and safety reps that one appoints is determined by the total number of staff in the organization or in the particular section. Then in terms of health and safety committees, one of these sections does address this. And, if you have more than 2 reps, you need to have a health and safety committee in place. The committees must meet at least once every 3 months. Minutes must be kept, shared with all staff and with management as well. And meetings must be kept for a minimum period of 3 years as per the Act. The number of committees that you have in your organization also depends on the number of staff. And also, you don't want too many health and safety reps on one committee, and then so you would try to maintain an even distribution. The committees also play an important role as they raise recommendations to the employer via or through the Health and Safety Committee meeting minutes. And they form a link between the worker and management in respect to SHE. Thanks, Ashraf.
Thanks, Michelle. Briefly, a follow-up. How do workers, health and safety reps and health and safety committees management link together? Just briefly on that link point you made. Go ahead.
Okay, thanks, Ashraf. So workers basically, as I mentioned, the health and safety rep is the eyes and ears on the ground. So workers would report unsafe conditions, incidents, etc., to them. And also then in terms of the Act, we need to do a safety inspections of the workplace. So if you find that these issues are not dealt with at local level on the ground, then it is the duty of the rep to then raise it and table it at the Health and Safety Committee meeting. Now that meeting is must have an employer representative present, and in the case of our organization, we've made it such that a management sits on this committee. So in actual fact, we closing that gap between the worker on the ground, the Health and Safety Committee, his manager, and then senior management. And then if anything is not sorted out at the workplace, then it's raised at committee level, and then the committee meeting minutes are signed by the Section 16.2 appointees. So we're closing that gap, and therefore we maintaining that nothing goes undealt with. Thanks.
Thanks, Michelle. So on the health and safety prevention point, accidents and incidents can happen. Workers get injured. What can be done to address this?
Okay, thanks, Ashraf. To start off with, based on the number of employees, you would have first aiders appointed in your organization. You would also have first aid boxes or first aid kits, and these first aiders would be trained. So if there are minor injuries, the first aiders probably can take care of that and assist first hand. However, if there's more serious injuries, then there needs to be a written protocol in place where you would indicate what needs to be done in certain cases. So in terms of the Act, there's something called Section 24 injuries. And these are injuries that are very serious. They are injuries that involve death. A person becomes unconscious, loses a limb or part of a limb. There's an explosion. There's a spill of a very toxic reagent or chemical. These incidents are classified as Section 24 incidents. And as such, the Act dictates that they need to be reported to the Department of Employment and Labor. And so there has to be a protocol in place in the organization. And also there needs to be a protocol for minor injuries in terms of the Act, like minor injuries and also near misses, because this is a chance for the organization to maintain, put controls in place so that these injuries do not recur. Thanks.
Thanks, Michelle. I'll return to a question about training to you and perhaps the other panelists. But just, Odette, a quick follow-up. Do all companies need to employ professional occupational hygienists and medical staff? Briefly, you have about 60 to 120 seconds. Go ahead.
Thanks, Sandra. I think it really depends on the company, what the company can afford, what the occupational health needs of the company, even the number of employees that the company has. So there's different models of service delivery. It can be internal or it can be external to the company. There are some, as a starting point, oftentimes companies have an occupational health practitioner, which is an occupational health trained nurse and a safety expert, and sometimes employ the services of an occupational medicine practitioner who is a doctor on a part-time basis. But then there are other models that include contracting private occupational health services. You can also have these mobile clinics that come to the company, and there also are contracted GPs that are trained then in occupational health, that have occupational health practices, that could see employees from workplaces. But it's important, and there's some, like the mining industry, that have a whole multidisciplinary team on site. But it's very important to whatever service the employer uses, they need to have, it needs to be integrated within their occupational health system. So this needs to be evaluated, monitored, so that there could be continuous improvement of the system, looking at elimination of controls being the end point and mitigating the risk.
A quick one on informal, unorganized workers. I mean, how do we address that? I need to move on to Prof. Zungulu Zungu.
Okay. Well, the informal workers, they are services for informal workers are very scanty, if there are any. And we know that truthfully, occupational health services are available for maybe 10% of all workers globally. So it's a global problem, and particularly even more so in the developed country, where and a lot of our GDP is contributed by the informal economy. So there has been a push with the WHO, the International Labour Organization, to have universal basic occupational health services for all workers. And this is something that does need to be addressed. The Occupational Health and Safety Act puts the onus on the employer to provide these services, but self-employed people are sort of outside of it. Informal workers are outside of it. So there is a little bit of a link up with services that maybe the public sector can fulfill this requirement, and it has worked in other countries to provide for the services outside of the formal economy.
Thank you very much, Nadir. Prof. Zungulu Zungu, could I ask you, how can government on a regulatory level, the issue of laws and regulations and enforcement, how can government or the regulator enhance the provision of occupational safety for our workplaces and workers in the workplace? Over to you, Prof.
Thank you. Thank you, Chair, for the opportunity. I just want to state that there is actually 5 things I would touch on today that I think that government can do in order to enhance the provision of occupational health services. One is that government should create an enabling environment for companies as well as employees to be able to access occupational health services. And I will come back to that shortly. The second thing is that once employees have been exposed to the workplace and they have developed occupational injuries and diseases, government must make sure that there are systems for redress so that employees are able to be compensated for that. The third thing I want to touch on, occupational health and safety is a very huge component or contributor to our public health diseases that we find in our country and across the globe. And as such, it is important that government creates a system where we can be able to measure the burden of disease that is caused by occupational diseases and injuries. And that can be done through having public health surveillance systems in place for us. So that's the third thing. The fourth thing that I want to touch on today is that government also must assist and work with all stakeholders in the workplace to create capacity for OHS. And we'll come to that as well. And finally, to say that government must always keep up with what's happening globally and internationally in terms of best practice, keeping up with what the International Labour Organization is recommending for the workplace. But going back to the first point of enabling environment quickly, is that in order for government to have this enabling environment for OHS, you need to have a committed leadership in government. And this committed leadership includes both political leadership as well as, senior civil servant in terms of the policymakers, administrators. Those are very key to us having an occupational health service, because without this committed leadership, which operates within ethical principles and moral behavior, because the ethical principles and the moral behavior is going to make it easy for those in government to take the hard decisions required to protect those who are vulnerable and exposed to occupational exposures, and of course, then developing injuries and diseases in the workplace. And secondly, following up on this enabling environment, is that the government, politicians as well as administrators need to have conviction and courage to make tough decisions about the health and safety of all workers, not just those in the formal economy, but those in the informal economy as well. Those in the formal economy, we must think about those who cannot afford the small and medium enterprises. So government needs to play a role there and not close their eyes. But despite all of these the qualities that I've listed above, of course, government has to enact the legislation that will protect and promote the occupational health and safety of workers. And that legislation hopefully will be in line with international best practices, such as ILO conventions and recommendations. This will assist us in setting up roles and responsibilities, establishing rules in the workplace for occupational health. And over and above enacting this legislation, government should enforce the legislation. Without the enforcement, there will be no occupational health services. And government need to promote access and equity in line with the South Africa's excellent laws, such as the Constitution and all the Occupational Health and Safety Acts, including the Mine Health and Safety Act, as well as the transport laws as well. But more important, that the National Health Act, we don't talk about it much. It also plays a role in occupational health. So I think for now, I'm just gonna stop there for purposes of time.
Thanks, Prof. That was quite detailed, quite thorough. Thank you for that. Briefly, my next question to you is, what are the challenges facing government in the delivery of occupational safety? You've covered some of those. Are there some final points you want to add in terms of those challenges? Over to you.
Well, there are challenges that government would face as a regulator. We know that occupational and environmental health in particular have regulations which can be sometimes perceived as burdensome due to the costs, and that they can impede, investment and growth into the country. However, we expect that government does not, relegate occupational health and safety because of such, that it works with those stakeholders that are in the economy to make sure there's a balance between OHS and the cost, as well as protecting the health of workers. Secondly, we have too many government departments working in OHS, too many of them, and working in silos. That needs to be addressed. The costs to government itself, notwithstanding the technical support from development agencies, may be considerable in terms of personnel and resources to make sure that the systems are in place to enforce, as well as to allow for occupational health services to be available for small and medium enterprises, as well as those in the informal economy. But government should find the means, as is stated in the Constitution, that we will have progressive realization of such. And we should also look at the results of promulgating minimum standards that are reasonable. And government should not be afraid to enforce those and make sure that they are promulgated. The role of the the Department of Health for small and medium enterprises, as well as informal economy, is a big challenge that needs to be addressed head on. Thank you.
Thank you very much. That's Prof. Muzi Zungu, who also heads our HIV/AIDS unit here at the National Institute for Occupational Health. And I'm pleased to then bring in our next guest, and that is Nedlac, who's got about a decade and a half of very practical experience within the labor movement, having obviously being a qualified practitioner in occupational nursing as well. Puleng, thank you for joining us today. So, I mean, a quick question to you, Puleng, as a starter, and you may want to maybe have some flexibility with regard to my own questions as well. A lot has been said about the responsibility and duty of the employer when it comes to health and safety and the workers in the workplace. Do workers have duties, or do they have rights? What are the responsibilities of the employer towards the workers? Over to you, Puleng.
Thank you, Chair. Good morning to everybody. Yes, employees have a duty and responsibilities towards health and safety in the workplace. Section 14 of the Occupational Health and Safety Act is very clear. Although this Occupational Health and Safety Act it's a pre-1994 piece of legislation. It is what we are using today. So Section 14 thereof is very clear that employees have a duty to health and safety in the workplace. They have to take reasonable care for the health and safety of themselves and their employees and their co-workers in the workplace, carry out lawful instructions with regards to health and safety. Also, they've got a duty to report any unsafe act in the workplace. They also have a duty to report any accident if they come across any accident in the workplace before the end of the shift. So those are some of their duties or their responsibilities towards health and safety in the workplace.
Thanks for that, Puleng. That was quite brief and succinct. I like that. Just on the point of rights, what rights do workers and employees have in the workplace, which is clearly responsibilities of the employer? Puleng, over to you.
I think everybody knows that the rights that the workers enjoy today in the workplace were not given to us on a silver platter. We fought for those rights. For instance, the Labor Relations Act, Section 14.4b, says a trade union representative has a duty to monitor employers' compliance with any law that is applicable in the workplace. And this includes Occupational Health and Safety Act, because it does not apply anywhere else except in the workplace. So these laws should not be read in isolation. LRA is the umbrella act in the workplace. Section 14.4, as I've mentioned, is very clear that a recognized trade unionists in the workplace have a duty to monitor employers' compliance with any law in the workplace. And they also have the right to sit in any committee, including the Occupational Health and Safety Committee in the workplace. Because if they don't sit in such committees, they will not be in a position to monitor employers' compliance with the same law.
Thanks for that, Puleng. A final question to you. What are some of the ways in which an employer can ensure workers complies with the Act, and to ensure that the employer itself does that too? Briefly, you have about 60 seconds. Thanks. Sorry, 60 to 90 seconds. Go ahead.
We have General Administrative Regulations 6 and 7 that was published in 2003. It gives trade unions or organized labor the right to negotiate for an agreement with regards to health and safety in the workplace. This was not possible prior to 2003. So this agreements by their own nature is an extension and an improvement of the rights that we have. So GAR 6 allows us to enter into an agreement with the employers in the workplace to negotiate for a health and safety agreement. For instance, that talks to how safety reps get elected, their term of office, how training gets conducted, etc. So if you have such an agreement, you shall have, improved on the rights and of the workers in the workplace.
Thank you very much, Puleng. So I just want to go to one or two questions. We've slightly over time, and I'm going to beg our attendees and participants' indulgences to allow me a few more minutes with your approval. Thanks. A quick comment for you, Puleng, is from your colleague Vanessa Leroux, who says that the government should open up occupational health clinics, public ones. I think she's commenting on Prof's comments and contributions. And she says that the government should resource them at our state hospitals. For example, in the Western Cape, we have a good occupational health clinic at Grootskloof called E16, who assists us where employers did not register a disease or injury. Thanks for that, Vanessa. So there is a question, Prof, and maybe I should put it to you on the issue of the NHI. Is the NHI, and for example, the point that Vanessa also raised about the funding of public occupational services in the public sector, in public hospitals, does the NHI have some future role with regard to the points you raised about compliance and the enforcement and the building of capacity for occupational safety? Prof, over to you.
Thank you. At the moment, we must remember that the NHI is still looking at how resources are going to be pooled to pay for health services. And in doing so, they have indicated that there is going to be a role for the Occupational Health and Safety Act, but we are not clear as yet in terms of the bouquet of services that will be bought through the NHI fund, if that will include occupational health services. From the discussions that have taken place, I think at the moment that is not top on the list of what government intends to do. Thank you.
Thanks, Prof. And as a roundup, I'm going to ask all our speakers, our panelists, just to join us openly. And I'm going to ask each, and I'll start with Dr. Odette Volming. You've been monitoring the question and answer box. You've been answering, like the other panelists and the non-speaking panelists, the questions there of our attendees. A final remark from you, or any particular question that is sort of popped up for you that's important to share with our attendees. Odette, over to you. Are you with us?
Thanks, Sasha. I think quite a few questions came up a little about, the obligations of the employer with regards to people who are working from home. And I think that is quite a topical issue at the moment and, quite contentious in terms of you working from home, using your own, supplies, office supplies, maybe you've been given by the employer. But what about health risk assessments? What about all these things and the services that should be available for you? Currently, as it stands, the Occupational Health and Safety Act still puts the onus on the employer to provide for a safe a working space for employees. So these things need to be thought about in the workplace. There needs to be kind of a system of teaching people how to do health risk assessments within their own sphere, in their home environment, to address and to prevent health issues and safety issues coming up along the line.
Thanks, Odette. Michelle, your final comments for the audience and any of those questions that we've been covering in the Q&A box there. Final word from you, Michelle.
Yes, I agree with Odette that many of the questions related to working from home. And I think it's quite simple. If you're looking at the Act, it says that your workplace, it refers to. So when you're working from home, your home is your workplace. So you likewise need to have a safe and healthy work environment, access to facilities such as hand washing, ventilation, a comfortable workstation, etc. So ablution facilities as well. So these are the critical things that need to be addressed. So the OHS Act still applies irrespective of where you are working because you are referring to your workplace. Thank you.
Thanks, Michelle. And Puleng, final remarks from your side before we depart. Puleng, are you with us?
Yes, yes, I
Great.
am.
Go ahead.
What was the question again?
Do you have a final remarks with regard to the importance of health and safety for workers in the workplace and for them to be active participants in that environment and process? 30 seconds, Pauline, go ahead.
Yes, look, like they said, we need to have an enabling environment. And some employers in the workplace, they just don't make it possible for us to participate in the structures. For instance, they would like us to believe that as job stewards, health and safety is the domain of the she-reps only, when the LRA is very clear that they have got a duty to monitor compliance. So the more we have strong unions in the workplace, the more we'll have workers knowing what their rights are with regards to health and safety in the workplace.
And that's the final word from our trade unionists on the panel. Our two medical professionals and specialists, Dr. Odette Volmink, occupational medical specialist, Professor Mzumkulu Zungu, the head of our HIV and TB unit in the National Institute for Occupational Health and Safety and part of the leadership here at the NIOH, and then Ms. Michelle Morgan, the key leader person in our SHE department here at the NIH, also serving over 7,000 employees within the National Health and Body Services. I need to say thank you very much to all of you, Dr. Volmink, Professor Zungu, Ms. Morgan, and Mr. Nedlac. Thank you very much for your contribution to this morning's panel discussion. And I want to thank all of our participants and attendees for the flexibility for me to go over time. And there's still a few other questions clearly we still need to answer. I see there's 6 open questions in the question and answer box, but I'll pause the session here and ask my IT colleague to keep the session open so that the panelists can see if they can address the outstanding questions in the question and answer box. And at this point in time, I say thank you very much to all of you. We will see you in the next webinar. That's the next online session in the webinar series, and that will be on the 30th of March. And we'll be dealing then with the issue of compliance and non-compliance in the workplace. And we're asking some of our regulatory specialists and experts to join us in that particular session. Thank you. Goodbye.